children. If you survive, don't do as we did. The son exclaims there'll be nothing to do to. Her daughter says she'll be dead with you. While foreign affairs are screwing rotten, light morale has hit rock bottom. Dying embers stand forgotten. The says she'll be dead with you. While foreign affairs are screwing rotten, light morale has hit rock bottom.
Hi, welcome to Topical Talk. My name is Jim Cirencione. On my right is Rob DiLorenzo.
How are you?
To my left, Matthew Roberts. Together, these gentlemen have over 20 years' experience in the healthcare field.
Correct. Yeah.
Today, the first thing we're going to be talking about is a little bit about healthcare reform and how it may be affecting us all in the future. Now, Rob, you have been dealing with a certain type of patient or patients from certain areas. Could you tell us a little bit about that?
Yeah, absolutely. I'm in an orthopedic outpatient facility, and I'm noticing now more than ever, out of all the years of doing this, that I'm seeing a lot of workman's comp patients, no-fault patients, and they talk to me, and they're telling me that they're miserable with their jobs, that they've been overworked, underpaid. Again, everyone always telling me cost of living, in this area very high, and they can't make ends meet, and most of them are very depressed, and they, instead of working and being, miserable and having a tough time, they're going out on workman's comp.
And what do their concerns seem to be for the upcoming healthcare reform?
Well, I'm just seeing majority that more than ever. I'm seeing so many patients that are. I feel all these patients, and plus, if you multiply with all these other facilities, it's draining the system. It's only making, I think, the economy worse. Of what I'm seeing, what's happening, and a lot of them, the MRIs and X-rays that are taken are negative. And some of the patients actually tell me this. They open up to me. One-on-one in the treatment rooms, and they're saying to me, I'm really miserable with my work, and I'm doing this. I'm like saying I got injured on the job in order to try to figure out how to advance themselves or go back to school or try to get something better. And they get half of the pay. They're getting half of their salary through workman's comp.
Will the healthcare reform help this situation, or do you not know?
I think it's a combination. The healthcare is a mess right now, and the economy. I think the economy is bringing out the worst of people and their situations. And it's scary. And I would say 80% of my patients right now are on workman's comp.
Wow.
And doesn't workman's comp come from, like, let's say in the state of New York,
an injury on the job.
An injury on the job. The employers of the company have to pay so much to the state.
For insurance.
For insurance. But then it's the actual state that is paying all these patients.
Well, the workers'
money,
comp
right?
carrier, whatever insurance company provides the workers' comp insurance, is the actual entity that writes the checks.
Does that come out of taxpayers' money?
I don't believe it comes directly out of taxpayers' money, because the actual workers' comp insurance is actually purchased from private companies.
Oh, it is private companies.
Yes.
Okay.
But there is,
but indirectly, it's draining. When you have millions of people, I'm assuming millions of people doing this across the country.
There is an entire workman's compensation system,
right,
which is then supported. And that does entail some government resources. There's administrative judges, there are workers' comp courtrooms, and it adds quite a bit of expense to it.
Right, absolutely.
Let me ask Matthew, what has your experience been, and what do you think about the upcoming healthcare reform? Is this going to help us, or is the situation going to remain static?
I think it's a wait and see type of thing. My experience is basically with the geriatric population. We're 65 and over. They're homebound. It's in home health care. They have different comorbidities, from end-stage renal disease, cancer patients, diabetics, amputees. And those patients are concerned what's going to be with this Medicare.
Do they ever voice their concerns as to what they're worried about in the upcoming reforms?
They do. They're wondering, do they need to keep a secondary insurance? Will that kick in? What
Right,
will Medicare pay? I mean, because providers are hearing it's going to be decreased reimbursements, and the patients are wondering how that's going to affect them.
I'm just to interrupt. I'm sorry. I'm hearing most people saying that, like what Matt is saying, that they really it's too premature and nobody knows. Even doctors that I speak to, I'm sure you speak to as well. Nobody knows what's going to happen. A lot of doctors told me that they may want to get out of the profession if the reimbursements drop any lower
I'm hearing
with
that
these
a lot.
insurance. And are you hearing that as well?
Yeah.
No, I think it's just it's premature to say, but it doesn't look good. It doesn't. To me, my opinion is it doesn't look good right now.
Okay.
Doesn't look
well,
good what I'm
that's
saying.
a
Matt, anything that you
pretty,
wanted to add, or some of the
sobering
patients?
view.
Yeah.
Are you seeing what type of diagnoses of patients are you seeing?
Well, like
Besides the ones you
elderly.
mentioned,
I mean,
besides
the ones patients who suffered strokes,
right,
who are dependent on their caregivers.
right.
It also puts I think this health reform needs to address caregivers, home health aides.
Absolutely.
I mean, there has to be some way to compensate these people the right way, so they don't have to. These patients don't have to be re-institutionalized in an inpatient, which would be more costly.
No, absolutely.
I would like to see that as part of the healthcare reform, if that's.
Okay.
But it's still it's a little nebulous right now.
Yep, right. I agree.
Have you fellows heard about our new Wall Street reforms in business?
No, I haven't.
Government
Matthew,
recently
have you?
passed a very extensive bill. It includes a Consumer Financial Protection Bureau. It
Okay.
includes Financial Services Oversight Council.
Okay.
It gives the federal government authority to break up large businesses. And it also includes some mortgage reforms. The bill is thousands of pages long, and it's very controversial. Some people feel that we don't know really what's in it yet. And before I left the house this morning on
Right.
one of the financial channels, I heard that financial rating agencies that rate bonds and stocks B, A, AA,
Right.
are balking at giving their ratings now because of this new law that is passed, because they may incur some liability if their ratings are wrong.
Are they saying this is unconstitutional, meaning that the government is going to have more regulation? I mean, listen, Wall Street went overboard, went crazy, right? The banks, like companies like AIG.
That's why they passed this law.
Well, I don't blame them. And sometimes I say to myself, when they gave all the bailouts, when the government gave the bail, I say, you know what? They should have let them collapse. It would have gave maybe smaller companies a chance to then, right? You agree?
Well, you're not
being
alone
an attorney,
in that
being an
point of
attorney.
view. That's one of the problems, and one of the problems this bill addresses is too big to fail. That there are some banks that are too big to fail, and that's why the government
Okay.
was given
Right.
breakup authority to actually seize and dismantle companies so that no one company
Could
is
get too large.
too big to fail.
No,